Senator Kaine.
Thank you, Chair Sanders and Ranking Member Cassidy, and thanks for this wonderful testimony, extremely illuminating. I want to dig into two issues, medical debt and parents, and then medical debt related to dental costs. Ms. Ward, I'm going to start about medical debt with parents and ask you a question. High medical costs connected to pregnancy and childbirth are significant financial burdens for new moms and new parents. About half of births in the country are covered by private insurance, and 2022 analysis of claims data suggests that out-of-pocket costs for moms about $3,000 in addition to other costs that they incur. A recent survey of people experiencing healthcare debt found that parents generally are significantly more likely than non-parents to have healthcare debt because of their own or their children's condition. And the debt that's being reported for moms does not include other medical debt that they may have incurred for the children. This is just around childbirth. Medical care for infants can result in higher out-of-pocket costs and debt. And then the out-of-pocket costs connected with pregnancy and childbirth, particularly for new parents, come at a time when families are experiencing income loss. If you work with one of the 75% of the employers in the country that doesn't often offer paid parental leave, and also if you're looking for childcare in a nation that doesn't do a very good job of funding affordable childcare, having a child puts this kind of triple whammy effect on you. The ordeal that you and your family face sounds very harrowing, and you mentioned in your testimony that you were forced to ration care due to the financial impact of these outstanding hospital bills. Talk a little bit about how debt relief would have impacted the lives of you and your family as your children were young.
I think the main thing is that some of our care and some of our expenses were not just related to the hospital care. It came later for therapy and other kinds of treatment. So I think if we had had the opportunity to have debt relief, we would have pursued those therapies sooner, or we would have continued all the necessary treatment that was recommended for the children in a way that was consistent with what their treatment plan looked like.
So this, if we could figure out a path forward on debt relief, this would be a very pro-parent, pro-family, pro-child policy, and I think that's an important thing. And I want to ask Dr. El-Said a little bit about dental bills. Senator Baldwin and I in March led a letter from a group of colleagues to the administration about persistent coverage gaps in essential health benefits. We asked the administration to initiate rulemaking to institute a minimum standard of coverage and to establish a permanent structure to regularly review what essential health benefits are. Not long after receiving our letter, the administration issued a final rule expanding access to dental benefits by finalizing measures to allow states the option to add routine adult dental services as an essential health benefit. So for the first time, every state will be able to update their EHB benchmark plans to include routine, non-pediatric dental services, cleanings, diagnostic x-rays, restorative services like fillings and root canals. I hear from Virginians about this all the time, problems with lack of dental care, distance from dental service provision leading to huge health and other challenges. In your testimony, you mentioned that dental bills are one of the leading causes of medical debt, with almost half of adults reporting them as the cause of their medical debt. We've taken a small but important step in updating the EHB to allow for dental coverage. Can you speak to the impact that debt related to dental bills has on your patients?
Yeah, Senator, thank you for your leadership. I'll tell you, we do this weird thing in this country where we decapitate the head from the body. So if it's health care for your teeth or your ears or your eyes or even your mental health, we consider it something different and apart. But we all know what happens if you decapitate a body. Thank you for your leadership on this front, because I do hope that states will take up the mantle of including this as an essential health benefit. We often think about teeth as being something separate and apart because it feels like what happens in the mouth stays in the mouth, except for we all know also that the mouth is the gateway to the rest of the body. And we know that patients with significant dental caries or other oral pathology are far more likely to suffer long-term chronic health illness. You think about something like heart disease related. You think about something like lung disease, also related. And if I can interrupt, sometimes a dental examination also reveals non-dental health conditions that are really important to catch early. You're correct. You think about oral cancer, often diagnosed at a dentist. So part of the responsibility here of thinking about debt is thinking about debt collectively, rather than making the mistake of, again, decapitating the head from the body. As we think about medical debt, given the statistic that you shared, nearly half of medical debt attributable to dental care, we need to be thinking about it collectively.
Thank you so much. Thanks, Mr. Chair.
Senator Budd.